watching this video from Waterfront Dentistry by Paul's. I'm Dr. Paul. Today I'd like to talk to you about teeth whitening. Now, teeth whitening is an error called bleaching, and the reason I say this is bleaching involves bleach, but teeth whitening actually involves hydrogen peroxide, which is an oxidizing agent. Your tooth is made of enamel, dentine, and what's inside is the nerve of the tooth. Enamel is extremely hard and extremely smooth, but it is in fact made of millions of prisms. Now, whenever you drink stuff like coffee, tea, wine, if you're a smoker, the smoke, all these things cause organic pigments to settle on the enamel prisms, and this is what causes your teeth to actually be much more yellow, dark brown, and even black than what your teeth are supposed to be. So what happens when you whiten your teeth is the nascent oxygen from the hydrogen peroxide whitens these pigments, so your teeth end up becoming as fair or white as it should be before all these organic pigments had a chance to go and stain them. So even though you might say teeth whitening, it's actually teeth oxidization, which results in teeth becoming as white as they should be. Now, two ways you can whiten your teeth. The first way is you go to a dental office, they shine a fairly harsh light to dehydrate your tooth or teeth, and then the whitening agent they use, which usually has a high percentage of hydrogen peroxide, whitens your teeth. Now, this way works beautifully, but the only problem is the nerve that lives inside your tooth a lot of times ends up getting sensitivity. Now, for people who end up whitening their teeth more often this way, there's actually internal damage that happens over the long course of time. Now, a lot of dentists recognize this, and now the way we whiten teeth is with systems, there are very many of them, but these systems have lesser hydrogen peroxide and they come in trays that are moldable to your teeth, which means to say that you can slowly titrate the whitening of your teeth in a way that you're comfortable and the teeth get whiter gradually. The advantage of doing this is there is less chances that you get sensitive over the course of time, and your teeth whitening actually is more stable than in opposed to the other way of doing it, which is in a jolt. The disadvantage, of course, is you don't instantaneously get a fairly white or bright smile, but it takes progressively a little longer. But in the grand scheme of things, if you have an event coming up and you whiten your teeth gradually, say 2 weeks prior, you have a fairly white smile. But if you suddenly remember, oh wow, I gotta go whiten my teeth, and you do this 2 days before the event, chances are during the event, whenever you're smiling, you will be extremely sensitive. So that being said, we highly recommend the gradual way of doing teeth whitening than the instantaneous way. The systems that we use in our dental offices, they come with 10 upper and 10 lower trays, and these trays have anywhere from 10 to 15% hydrogen peroxide. The beautiful part about this is you get a box which has, like I said, 10 upper and 10 lower trays, and say you use 4 or 5 of them and your teeth have either gotten much wider than it was and you're happy with it, you can always stop, put the rest of them in the fridge, and you can reuse it before any event like a birthday or a wedding or anything like that. Now, after using 4 or 5 trays, if your teeth start getting sensitive, you can still pause, put the rest of them on the fridge, and over the course of time, as you use your toothbrush and your floss, you can also use a little bit of Sensodyne as a cream on your fingertip, and once you dry your teeth, you can kind of massage the Sensodyne onto your teeth that are either getting sensitive, or in general you just want to be a little more harsh on them with the whitening. Now, what that I mean is your eye teeth or your canines are by default a little yellower than the rest of your other teeth. So if you notice that my rest of my teeth are fairly bright, but my canines are still a little yellow, I want to try maybe oxidizing them a little more. You can put Sensodyne on all your other teeth except your canines, and you can try whitening it a little more, maybe a tray or 2 more, and your canine might end up becoming a little brighter than the rest of your other teeth. It's worth a shot. A lot of people have had success with this, but like I said, in general, slowly but surely is better than instantly and harshly, because when you do stuff, especially whitening on your teeth instantaneously, it ends up becoming more sensitive. I hope this has shed some light into the topic, and if you have any questions regarding this subject, you can always send us an email or give a call to our office, and we would be delighted to help you. Thanks for watching.